So the underlying idea behind an anxiety disorder is that kids are more afraid and nervous than we would expect them to be. So part of that is an irrational fear that there's really no basis for. They just always been nervous. It's always been sort of shy and they're nervous, but they're pretty socially skilled and kids like them as much as anyone else, but they're just really afraid they'll make a mistake, say the wrong thing, and so we need to help them face their fears. But for some anxiety disorders, have their generation in a either an unpleasant or traumatic event. So sometimes social anxiety comes from kids being bullied in the past, or a fear of dogs comes from a dog bite, or OCD comes from throwing up and getting sick. And so the first thing we want to make sure is that currently kids are safe. Because if they are still in a stressful situation, they're being bullied, there's a dangerous dog in the neighborhood, we don't do exposures to things that are actually dangerous and harmful. But if the source of a fear is a traumatic incident that is now over, then exposure therapy is still appropriate. And post-traumatic stress disorder, where people have been through sometimes horrific events, treatment is exposure therapy to those memories and reminders of them.